Welcome to yet another edition of Pet Talk with Dr. Lee. I'm your host, Tim Gant. No, this is not a new look for me. I'm not going for the Elton John. We are talking today about laser therapy. I'm joined once again with Dr. Lee.
Hello.
How are you today?
Fine, thanks.
Good. Now, who is this lovely young lady with you?
Well, I'm very pleased to present my wife, Dr. Bernadette Spector, and she's here to discuss laser therapy with us today. It should be a real treat.
Bernadette, how are you?
Okay, Tim, how are you?
Good. Good. We should take off the glasses now, I think. Yes.
Yep.
It's a little odd coloring. Tell us about this laser therapy. Is it new? Is it,
This type of laser therapy is new to the United States. This laser actually was developed in Europe, and it is special because the laser, this is a class 4 cold laser therapy unit. The previous ones were only one frequency. This is a special one. This is called a multimodal laser unit, where it has a laser frequency for edema and swelling, and then it also has a locked laser frequency on it to remove pain and give analgesia. Most lasers, cold laser therapy units, are just for edema and swelling. So this reduces edema and swelling and pain. So that's what's good about this one. We started using this about 4 or 5 months ago. We've treated several patients. There are a number of problems that you can treat them, as you'll see later on. We've treated severe arthritis in shoulders and elbows. We actually treated one pet who you'll see later, Bella. She had a severe back problem where she was actually paralyzed. She had such a severely herniated disc, she couldn't use her back legs. And with treatment and with laser therapy, we have her walking now, which is pretty incredible, because a lot of these dogs that go through this can't walk, or they have to have major expensive orthopedic surgery, and they still aren't totally back to normal. But as you'll see later, Bella is absolutely walking fine, and she's cute, she's terrific. We can actually treat wounds, sprains. We can treat surgical incisions. It helps them to heal faster and better and reduce swelling and inflammation as the animal is recuperating from any type of surgery. We've used it for nerve damage. You can even use it for nerve regeneration. I actually had a client come in with her cat, who, when she woke up in the morning, the cat's leg was just dragging and couldn't walk. We radiographed it. There was no fractures, nothing, no wounds. We did laser therapy on it that night, and the next morning the cat could walk 75% better.
Wow. Now, how were you introduced to this technology?
I actually studied lasers for the past year because I wanted to introduce it to our practice at Gray Fox Animal Hospital. And it's pretty special. It's a very powerful treatment, but it's very gentle. It reduces swelling, pain. It helps increase the tensile strength of muscles, tendons, and ligaments. It's incredible what it can do to help the animals. And we wanted something that was powerful but yet gentle.
Definitely, definitely. And what's the is there a price range to this? Is it?
Every treatment is based on the amount of time and how much of the treatments that we have to do. Normally the treatments start out at 3 times a week for 3 weeks, and I evaluate the patient after the 3rd treatment, and the doctor sets the treatment protocol. Then we have our technicians come in and they do the laser therapy on the pets with the owner there. That's why we wear our glasses, because it's very important that we wear glasses, and we can put the goggles on the dogs, because we have found out that lasers can damage retinas of the eyes. The 4 things that you cannot use laser on is eyes, thyroids, fetuses, and cancer. Those are the 4 things that you should not use laser therapy on.
And it just would cause more damage,
Correct.
Most likely.
You're putting energy into things you shouldn't put energy into.
Okay. Well, we're just about ready to go to break. We're going to be joining with some patients of yours, both Dr. Lee and Dr. Bernadette's patients, and some of the benefits they had from laser therapy. So we're going to take a break, and we'll see you in a little bit. Welcome back to Pet Talk with Dr. Lee. Once again, Dr. Lee is not here, so we're joined with Dr. Bernadette. Dr. Bernadette, how are you?
I'm fine today. How are you?
Good. And we were talking about laser therapy in animals and pets, and you know its benefits and different things. And we're joined with Karen, and Karen owns Cherry, which is a long-haired, beautiful long-haired miniature dachshund.
Thank you.
So, Cherry had some laser therapy, correct?
Correct. Cherry actually is an equivalent of one of our Olympians. Cherry is a breed champion. She's also an obedience champion and an agility champion. Cherry actually received 2 mock titles, which is pretty tremendous, and she recently from the AKC received her Masters Century title and certificate, which means she's completed over 100 perfect standard runs, which is pretty incredible. She's an athlete where she does the running, the jumping, and all that, so she needs her back, and that's important.
And how long has she been doing this?
About 5 years.
5 years.
5 years, and just recently she had a back injury where she had a herniated disc. We radiographed her, and she had a little bit of arthritis, and Mom found out when Cherry went to do a run, and Cherry just sat there and couldn't move. So Karen brought Cherry in, and we radiographed her, and then we found out about the disc, and we started oral prednisone, which is part of the treatment, and then we started laser therapy on her. The laser therapy actually helps to strengthen the muscles and the tendons and the ligaments around the herniated disc where the problem was, and it helps remove and a lot of the pain associated with that, and a lot of pain with the mild arthritis she has in her right hip. And we're going to set up a little mock demonstration for you to let you know, to see what it's like when owners come in with their pets. It's a powerful treatment, but it's very mild. The animals actually love it, and it's a great bonding time with the owners and the pets. Cherry actually ran this weekend, and she was zipping around Dream Park, doing her thing, and no pain. So we're going to give you a little demonstration.
Okay.
I'd like to introduce one of our technicians, Rainey, who helps. She's one of our trained technicians at Gray Fox Animal Hospital who does the actual treatments.
How are you, Rainey?
Good, how are you?
Hi, you want to come on in here, Rain, and we'll...
Okay, you want me to put her on the table?
Okay. So we all wear glasses because lasers are very powerful. We're not going to actually do the treatment. We're going to show you what it's like. We do this because lasers can actually damage retinas.
Okay.
And we have little doggles for the doggies. So what we would do with Cherry is, whoops, put these on, photo op time. And then what we would do is we would set up the treatment on this is actually the brains of the laser therapy unit, and this is the wand which gives the treatment. So we set it up, and the owners actually are in the room because we all wear glasses and it's very mild. So her problem was actually from her lumbar spine back and her right hip.
Okay.
So I set up the treatment as the doctor, and then the technicians come in and carry it out. So Rainey would actually come in, and she actually does the treatment all along the spine here. You can show them how you do it. And it's very gentle. And the dogs are actually just sit here like this. Actually, Cherry will actually lay down like this sometimes. It's so soothing to her, and she actually feels good. I think she likes her goggles. You're a star.
How often does Cherry get this done?
Initially, we start out with 3 treatments a week, and we do that for 3 weeks, and each week I evaluate the patient. At the end of the 3rd treatment, I talk to the owners, we do pain evaluation and see how the animal's doing, what they need added or removed, and then we do sometimes maintenance. Now Cherry's on maintenance treatment now. She gets it every 2 weeks, her laser therapy. It actually really improves her muscles and her tendons because they were the ones that were damaged when she had the herniated disc. So it actually improves vascularity, it improves tensile strength to her muscles and tendons, which are very important because she's, like I said, almost the equivalent of an Olympic athlete. She is running and jumping and doing it. If anyone's ever seen agility trials, these dogs are jumping, going up A-frames, walking on things, running through tunnels, very, very athletic. Right, Chair? You're a good girl.
Now, is there physical therapy for some animals associated with this that you guys do, like any besides?
Yes, we also added some physical therapy. Mom does a little exercise with Cherry. She massages her backs. She has an exercise ball that she will exercise Cherry on also. Very gentle. You always want to do gentle exercise as supportive therapy.
Well, she's doing a good job.
But there's just some of Cherry's ribbons that she's won. She's pretty famous.
Now, Karen, did you want to describe what these ribbons are?
Well, Cherry has 2 mocks. A mock is a Master Agility Championship. There are only about 15 or 16 dachshunds in the country that have a mock. Cherry has 2 mocks, so we're really proud of her. And these are some of the ribbons and rosettes that she's received as a result of getting the mock or running in agility. And they also give you a mock bar, which is the bar behind it, and you get to run around the ring with the dog when you get a mock bar. And I just want to say about the laser therapy, Cherry was really down for about 5 months ago. She wasn't running at all, and we took our time, let her stay out of the ring for a while, let her rest, let her back rest. Dr. Bernadette did the treatments regularly with her, and as I said, about 5 months ago we started this, and 2 weeks ago I put her back in the ring, and she was dynamite. So it's been great.
That's 110%.
That's important. I mean, for her, she's such an athlete. For her to recuperate and recover like that it's incredible.
All right,
and this is literally how they sit there when they have their treatments. Very
relaxed and
relaxed, calming. They love it.
We have about 30 seconds left. I just want to, thank you guys for coming in, sharing Cherry with us. She's a very beautiful dog.
Thank you.
And
she is. She's awesome.
Once again, we're going to take another break. Welcome back. Again, we're joined with Dr. Bernadette. Dr. Bernadette, we have another patient here of yours that you treated with laser therapy, Rudy Valentino, correct? And his owner, Stephanie. So, what did Rudy have done to him?
Well, Rudy is an English bulldog, and he was recently diagnosed with severe arthritis in his right shoulder and right elbow. And then we found out he had it in his left shoulder and left elbow also. So we started laser therapy on Rudy, and every week we monitored him and asked Mom and Dad how he was doing. And it took a while. We actually added some supplements to his diet to help improve and decrease the arthritis and the pain in his elbow and his shoulder. And then we did laser therapy on him. And it took about a good month or 2 after we started the laser therapy before Dad actually said, wow, he's running around in the backyard and he's not limping. But Rudy would limp severely in pain on his right leg and his left leg.
And how much does Rudy weigh? It seems like a big dog. Not saying he's overweight, but
No, Rudy's not overweight. Rudy's in great shape. Yeah. Rudy weighs about 60 pounds.
60 pounds. Yeah. Dog. Now, what type of supplements you were talking about earlier? Would you?
He gets something called Dasequin that helps reduce the inflammation in the joint, and he's on the Performance, correct?
He's on Performance.
He's on Performance. That's also a supplement that helps decrease the inflammation and support the joints.
And the Forte.
And and Glucoflex. He's on glucosamine.
And how old is Rudy?
Rudy's 7 years old.
7 years old.
So it's about middle age. For a big dog. Very handsome, Rudy.
He's the soundtrack to the show today.
Yeah. He's awesome. At first he was a little antsy when we first started treatment. Then once we started, I could actually see how he could feel the energy going into the joints, and he would just settle down. As long as he could kiss Renee, his technician who did his therapy on him, he loved it.
Now, due to the size of a dog, to the weight of the dog, does the intensity of the laser increase or anything like that?
Actually, the intensity is based on the problem. Okay. So we've treated like Cherry with intervertebral disc disease. We're treating Rudy. We did some chronic inflammation because that's what arthritis causes, and we treat him with the setting for arthritis. So there are different settings, different frequencies, and amount of energy that goes into each treatment. And the time span. So first we used to do point to point around the joint. but then we started to do scanning treatment, which is actually better because it's a continuous flow of the energy that we're actually putting in the joint. And this energy is actually, again, like I said before, it increases the tensile strength of the muscles and the tendons and ligaments. It decreases the inflammation and the pain. It also decreases the edema. It opens up the lymph drainage, so the swelling and pain goes down in these joints and actually helps these pets be mobile without pain, and they just run around and have a lot of fun. And that's our goal, is to let them be pain-free.
Yes.
But this is a powerful but yet such a gentle treatment. We love it, and they love it. They just sit there with their technicians and their owners that are treating them, and it's a fun time for them.
And we're joined again by another one of your veterinarian technicians.
This is Renee. She's another one of our technicians at Great Fox Animal Hospital who does the laser therapy.
Okay, and did you want to demonstrate maybe, you know, how you would handle...
We're going to demonstrate how we do Rudy's laser therapy. We all put our glasses on, except for Rudy. Now we're going to try Rudy with his goggles. Hi, Rudy. All right, photo op. Here we go, Rudy.
I guess I can hand this to you.
Yep, and this is how Renee does Rudy's treatments. Try the right one so they can see it.
Let me try the right
Yep, so she will actually put the laser right on his shoulder like that, and she will scan it, and she will go down, and she's actually sending the laser beam into the shoulder joint. You are such a ham. And this is literally how Rudy sits there, unless he's kissing Renee, because he loves Renee, and he kisses her all the time.
Thank you.
There you go.
Special bond between technician and dog.
Absolutely. So that's how we do the treatment there, and his elbow. And sometimes it takes about 8 minutes, and he just sits there. He's awesome, and he sits there with his mom or his dad, and he gets his treatment done, and then he runs out.
Now, is 8 minutes like the normal therapy time for everyone?
No,
or?
it varies for each one.
Okay.
Like I said, the problem determines how much frequency and how long we do it. Okay, Rudy.
Okay, good job.
He did a good job. Thank you, Rudy.
Oh, yes, there you are. Good job. Good job.
All right, we just have about a minute left. I just want to, thank you, Stephanie, and Rudy Valentino for coming out. And thank you, Renee, for all your help. And we'll be right back after this break. Welcome back. We're joined once again with Dr. Bernadette and also her husband, Dr. Lee. So it's Spector squared.
Yes.
2 Spectors in one building. It's kind of scary, but it happens all the time, right?
It does.
All right. We have also Bella joined with us. Bella has had some issues, and still a little bit does. She benefited from laser therapy. She's your patient, doctor. So,
all right. Bella came to us about 6 weeks ago. She was severely affected by a slip disc. This is the problem that you described in the dachshund. This one was even more severe. She could not walk in the hind legs at all, and she was in some significant pain. We gave her medication to reduce the pain. We brought her into the hospital. We gave her intravenous medications that reduced the swelling in the spinal cord, with the idea to reduce the pressure that the slip disc put on the spinal cord. And she showed some improvement over 2 days, but not a lot. And we needed to get her to the point where she could walk reasonably comfortably and be mobile. So we started with the laser therapy. We actually started it immediately. And we were doing it 3 times a week. And then after a month of improvement, we've reduced her now to about once a week. And she's showing very significant improvement since we started all the treatment. But she was cared for intensively. She really had a problem.
Now, what initially caused her, slip disc? And
there's a good question about that. Slip discs are probably more the result of genetics. Certain breeds run into it, dachshunds, beagles. It has something to do with the fact that the discs probably degenerate or calcify, largely because they've been built to be so low. Mm-hmm. Beyond that, there's probably some minor trauma, but the trauma that occurs is not such as being hit by a car. It's usually the kind of trauma just turning your head, turning your back, maybe taking a little jump. And that seems to be enough if they're susceptible to it to have the problem. We don't usually ascribe this to trauma. It's more of a breed problem.
Now, what kind of medications was she on initially for the pain?
She was on mannitol, which is a sugary solution that you give intravenously, and it pulls the fluid right out of the spinal cord to shrink it a little bit because it's usually swollen with the problem. And we gave her dexamethasone to keep it from swelling more. That also reduces the inflammation. Okay. And then we gave laser therapy right off the bat.
And that helped significantly, it
yes.
seems. And she's walking around.
And if they seem really painful, we give some form of a narcotic as well for pain relief. Okay. She's not on any of that now.
No.
Seems like an overall happy dog.
Laser therapy.
Which is, now the laser therapy has no side effects, unlike all the other medications. We have to balance the side effects with the benefit. But with the laser therapy, fortunately, there's virtually no side effects.
And that's good. That's it's hard to find something like that, isn't it?
Yes.
Most of the time.
But my wife actually does the laser therapy. She's the one that makes up the protocol. Amy here was one of the technicians that actually does it. Worked with Bella extensively. And my wife can tell you about the laser therapy
So we
itself.
can just give you just like a mock treatment, show you how we did the laser therapy. Here's the laser unit. This is, again, we all put our glasses on because the laser beam can, okay, we're not actually going to do it, but we're just doing a mock one. But lasers can actually damage retinas, and we're going to talk, we've talked about this in the first show, how you have to be careful with certain tissue not to use it on. So we get Bella's little. Come here, Bella. There you go, honey. Whoops. There you go. Little up. There we go. So then Amy would take the laser wand, and because her damage was in her spine here, she puts it on each side of the spinal cord to help increase the tensile strength and to remove the swelling and the pain and the edema. And literally the dogs just sit there like this, and they actually feel the energy, and they're just very calm. And they really bond with the technicians, and it's a wonderful time with the owner to bond with them also. Okay, we're going to get your little glasses off. Okay, that's all right. Good girl. So what we want to do is show you how she is walking now.
Oh, definitely.
But it's really helped her.
Because she couldn't before, right?
No, she could not. She could. She just drugged both of her back legs. She could not walk. So we're going to put her down. She's got a great pattern on her back. She's awesome. So we're going to put you over here, Belle. Make sure you're not caught in me. Okay, go ahead, sweetheart. Show everybody how you can walk. Good girl.
Good job.
She could not do that. But 8 weeks ago, she drugged her back legs. She had no feeling in them. She couldn't walk. And with the medication and with the laser therapy, now she can walk. Bella, hey Bella, come on, baby. Come on, baby. Come on. Oh, you good girl. Oh, look at that pattern. What an awesome pattern. You good girl. Oh, look at her. But she could not walk at all. So this is basically like a miracle. Dogs that have this problem usually have to have major orthopedic surgery, and she didn't have to undergo that. So I feel that that's pretty tremendous.
Now is it only going to get better from here?
Yep. She's going to get her maintenance therapy, which keeps her back strong, the tensile strength in her muscles and tendons and ligaments, reduces any pain, any swelling and edema, which actually damage the spinal cord, so we're going to prevent that from getting worse.
All right, we've just about run out of time. I want to thank you guys for coming and with this very interesting show today, and join us next time for another edition of Pet Talk with Dr. Lee.